Welcome to Module 1 on First Aid Procedures. In this video, you'll learn essential first aid techniques, especially curated for migrants who often find themselves in unfamiliar environments. Let's get started. First aid training is crucial for migrants, providing them with the skills to handle emergency situations when immediate medical assistance is not available. This module aims to equip you with fundamental first aid knowledge, helping you feel secure and empowered in your new environment. In this module, we will address the importance of mental health, particularly for migrants and refugees. You'll learn to identify risk factors and strategies for self-assessment, prevention, and treatment of common mental health issues. By the end of this module, participants will gain knowledge, skills, and attitudes essential for effective first aid. You will understand the importance of quick response, develop health literacy and technical skills, and learn to remain calm and composed during emergencies. First aid procedures are immediate medical interventions for abrupt illnesses or injuries. These procedures stabilize the injured, prevent further damage, and provide temporary relief until professional medical help arrives. Typical first aid procedures include assessing the situation, examining the individual's airway and respiration, controlling hemorrhage, treating burns, performing CPR, and immobilizing fractures. Understanding these protocols is critical for effective emergency response. Migrants often face language barriers, cultural differences, and lack of local knowledge, making it hard to navigate the healthcare system. First aid training empowers them to act in emergencies, even if communication with emergency services is challenging. First aid training helps migrants integrate into their communities, building trust and relationships with neighbors. Providing assistance in crises shows care for the community's well-being. First aid training is a valuable skill for migrants, offering a sense of security and empowerment. Organizations and communities should provide these training opportunities to create a safer and more resilient society. In many EU countries, providing first aid is a legal obligation. The law protects individuals acting in good faith and with reasonable care. Failing to assist someone in need can result in legal consequences. In emergencies, provide first aid before seeking additional help. Steps include scene assessment, checking responsiveness, calling for help, and starting CPR if necessary. Always prioritize your safety while assisting others. Assess the situation, check responsiveness, call for help, and start by checking the person's airway, breathing, and circulation. If needed, perform CPR or use an AED. Apply pressure to bleeding wounds, treat burns with cool water, and administer an EpiPen for severe allergic reactions. Comfort and reassure the person until help arrives. Remember, always prioritize your safety and well-being while providing first aid assistance. Do not attempt to perform any procedures that you are not trained to do, and always seek medical assistance as soon as possible. Basic first aid techniques include treating cuts, burns, fractures, allergic reactions, and choking. Detailed steps and videos are provided to guide you through each scenario. Clean the wound, apply pressure to stop bleeding, apply antiseptic cream, cover with a sterile bandage, elevate the wounded area, monitor for infection, and seek medical attention if needed. Elevate the wound to reduce swelling and bleeding. Watch for infection signs like pain, redness, swelling, or pus. Seek immediate medical attention if the wound is deep, large, or doesn't stop bleeding. Remove the person from the burn source, cool the burn with water, remove clothing near the burn, cover with a sterile bandage, and seek medical attention for severe burns. Avoid breaking blisters and applying creams. Do not break blisters from burns. Seek medical help for severe burns, especially if on the face, hands, feet, or genitals, or if the person has trouble breathing or shows signs of shock. Watch for infection signs and get medical attention if they appear. Call for emergency help, keep the injured person still, stabilize the injured limb, apply a cold compress, elevate the limb, monitor breathing and pulse, provide reassurance, and avoid moving the person unnecessarily. Identify and remove the allergen, administer an epinephrine autoinjector, lay the person down, monitor vital signs, perform CPR if necessary, and call for emergency help if symptoms worsen. Encourage coughing, perform abdominal thrusts, call for emergency assistance, and provide back blows or chest thrusts if needed. Watch the video on the Heimlich maneuver for detailed guidance. Watch the video that presents the first aid technique in case of choking. Do you know how to perform Heimlich maneuver correctly? CPR involves chest compressions, rescue breathing, and using an AED. Watch the video on performing CPR on an adult for detailed instructions. CPR maintains blood circulation and oxygenation during cardiac arrest, preventing permanent damage to the brain and vital organs. Only trained individuals should perform CPR. Ensure scene safety, assess responsiveness, call for help, check for breathing, start chest compressions, and provide rescue breaths. Continue cycles of 30 compressions and 2 breaths until help arrives or the person breathes. Only trained individuals should perform CPR due to its physical demands. Now, let's test your knowledge with a quick assessment. Read the case study presented below and then answer the questions from the assessment. A man experiences cardiac arrest during a run. A passerby performs CPR, helping him regain consciousness and breathe until paramedics arrive. The quick response likely saved his life. The passerby performs CPR, gives rescue breaths, and monitors the man's vitals until help arrives. The passerby's knowledge and quick actions highlight the importance of first aid training. Test your knowledge with these assessment questions. Answer them based on what you have learned about CPR, emergency services, and the cycle of CPR. Let's review the correct answers to the assessment. The correct answers are 1. CPR is cardiopulmonary resuscitation. 2. The emergency service phone number is 112. 3. The cycle of CPR consists of 30 compressions and 2 breaths. We hope you got all the answers correct. For more information and resources, please visit the links provided in the description. The Health Me Project is co-funded by the European Union. Views and opinions expressed are, however, those of the authors only and do not necessarily reflect those of the European Union or the European Education and Culture Executive Agency, and neither can be held responsible.